73rd CSI meeting. I am Dr. Johann Christopher, consultant cardiologist at the CARE Hospital, Hyderabad, and today I will be talking to you about cardiac MRI and its role in cardiovascular diseases. And interestingly, this is a chapter that we've written for the cardiology update, so please look it up and you will find some enormous insights into how cardiac MRI can be harnessed in the field of cardiovascular medicine. Cardiac MRI is known as a multi-dimensional tool. It's non-invasive and non-radiating. So what that means is you shouldn't have a hesitation in sending a patient for a cardiac MRI, and you should not have a hesitation in referring that patient as a longitudinal follow-up, because that is where it really shines most. It has a very, very high inter-observer and also has a very, very high accuracy, and most importantly, its longitudinal follow-up is also excellent. Now, we don't suggest cardiac MRI for all patients with cardiovascular disease, but 4 specific areas where we would recommend a CMR is in the field of LVH, which is not appropriately diagnosed, in the field of heart failure when there is a question mark on the diagnosis, question mark on the treatment modality, and also the prognosis, especially in RV diseases, SP-RV dilatation, whether it's congenital heart disease or it's patients with ARVD or it is patient with idiopathic PAH. CMR is very, very good in assessing the RV function and following up these patients longitudinally. The last area where it is assumed a lot of importance in the recent years is in electrophysiology and arrhythmias, in which the modifiable substrate, which is becoming increasingly the norm today, is best suited for cardiac MRI because it can image a whole series of diseases, especially non-ischemic cardiomyopathies, very well. And with the T1 mapping protocol that is in place, parametric and volumetric imaging can be done, and it is excellent for diagnosis of certain diseases like amyloidosis and sarcoidosis, where sometimes conventional tools like the ECG echo and the X-rays really fall short. So overall, I think cardiac MRI is a one-stop solution, especially in these 4 fields. It is very important to send these patients for a cardiac MRI at least once in their lifetime, because it adds information more than what the echo can give. It is add-on value. It helps in prognostication. As you know, scar burden is very important for sudden cardiac death, and the presence of 15% scar, especially in HCM patients, puts them at very high risk of SCD. And also, these are patients best suited for ICD in a resource poor country like India, where we can't just do ICDs for all HCMs. So I think cardiac MRI is a wonderful tool. It is a very good diagnostic, prognostic, and treatment tool, and most important, it refines our practice and enables us to do better with whatever less that we have. Thank you very much.